Welcome to Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware Healthcare Reality.
Hi, this is Dr. Nick Biasotto, host of the Medical Society of Delaware podcast titled Delaware Healthcare Reality. Before I interview our two guests today, I'd like to tell you how you can join us on our podcast. You can listen on Podbean, which is one of my favorites, or on any of your favorite podcast platforms. Look up Delaware Healthcare Reality, and you can hook into any one of our 12 podcasts at this point. And also, secondly, before we begin on our subject of diversity, equity, and inclusion, I'd like to mention a brief study that was done at the Imperial College in London regarding GLP-1s. Previously, we had a good conversation with one of our obesity experts in our podcast on obesity, and we discussed these chemicals and how they're used and revolutionizing weight loss in the United States. But recently, it was found that GLP-1s may have an influence on slowing Alzheimer's disease, i.e., they did MRIs prior and PET scans prior to the study, and then after the study was completed on 204 patients, and they found that brain shrank less and memory loss was slowed. Just to let you know, we're keeping up with the latest on some of the things we talked about earlier. Okay. Our guests today are Dr. Cydney Teal, who will speak to us on this issue in the very near future here, and Jennifer Thompkins. Their bios are as follows. Dr. Cydney Teal is a primary care physician with dual board certifications in internal medicine and family medicine. She attended Medical College of Virginia with a residency at Ochsner's Foundation in New Orleans, Louisiana, and completed her MBA at the University of Massachusetts at Amherst. Dr. Teal's previous leadership experience includes becoming first Chief Medical Officer at Christiana Care Union Hospital in Elkton, Maryland, as well as a former primary care service line leader and department chair of family and community medicine at Christiana Care in Wilmington, Delaware. Currently, Dr. Teal serves as Chief Medical Officer for Reciprocity Health, a startup health tech company where she provides expertise in public health, value-based care, health equity, and evidence-based practice. In addition to her role as CMO, she is co-founder and Chief Executive Officer of Delaware Health Equity Coalition, Inc., a nonprofit healthcare organization whose mission is to provide comprehensive, culturally appropriate, high-quality health care that educates, empowers, and engages our patients in a manner that fosters empathy, compassion, trustworthiness, while mitigating the health inequities that exist in our community. Dr. Teal is also a member of the Medical Society of Delaware's DE&I committee. Our second guest is Jennifer Thompkins. Ms. Thompkins presently serves as the Metropolitan Wilmington Urban League 5th President and CEO. She sits on the Wilmington Center for Equity, Education, and Policy, the Racial Equity Consortium, and the Reading Consortium. Prior to her work as president of the Metropolitan Wilmington Union Urban League, she served as director and then senior director of TriZen, a business consulting and leadership development company since 2017. Jennifer holds a BA in History and African Studies from Ursinus College and a Master's of Theology Studies from Harvard University. Jennifer has held board positions with City Year Philadelphia and currently sits on the Recognition Opportunity for Service and Education Foundation Board. Jennifer has received the Ursinus College Rising Star Award and was recognized as a National Urban League leader. One of the quotes she has in her bio is, "Those who learn, teach," which is an African proverb. Welcome, ladies.
Thank you.
Okay.
Thanks for having us.
Good to have you here. My first question is to Dr. Teal. Dr. Teal, being a member of the DEI Committee of the Medical Society of Delaware, what goals and commitments do you have in that committee?
Sure. So thank you for having us, Dr. Biasotto. So The Medical Society of Delaware, the DEI committee was a committee that was formed from the membership committee as a result of really sort of looking at the landscape of healthcare, looking at from a public health viewpoint, and understanding where the Medical Society of Delaware strategically wanted to go in terms of its goals. Mm-hmm. One of its goals was, or is, I should say, not was, is in the strategic plan of 2023 to 2026, is to really see a healthier Delaware. And understanding that Delaware's demographics are constantly changing. We have a significant increase in a number of people who are retiring in the community. We have an increased number of people of color in the community. We have multiple ethnicities. We have multiple people who are joining, who are identifying with other kinds of differences that we have from a community standpoint. And so in response to those, to the increasing changes in the community landscape, the Medical Society of Delaware and the DEI subcommittee have taken on the challenge of developing goals to address those changes. One of those changes includes, for this committee, is to expand the exposure of the Medical Society of Delaware physicians and the community to one another. And the way in which that is occurring is through the development of greater partnerships and collaborations with community-based organizations. In my experience, I've been a Delawarean for 3 years, and in the last 3 years, and especially in the last 3 years as being part of Delaware Health Equity Coalition, being part of Metropolitan Wilmington Urban League, and the Medical Society DEI subcommittee, I've learned and met probably over 70 community-based organizations who all strive to increase awareness and exposure of the community to the other health resources that are out there. And you'd be surprised how much of a health desert, health literacy desert exists literally probably 3 minutes from where we are right now, but certainly within Newcastle County, Kent County, and Sussex County. So really our goal, and all of our members who sit on the DEI subcommittee are from all 3 counties. And our goal really is to expose ourselves to those community-based organizations, outreach, participation, collaboration, so that we can expose our members as well as the community to one another.
Very good. If a medical society can be in any help to foster what your goals are, we'll be happy to give you some assistance.
Thank you.
Okay. Well, let me begin by defining DEI as noted from Webster's dictionary.
Yeah.
Diversity, difference, unlikeness, equity, fairness, giving a person their due, inclusion, to be a part of the whole, for example, respecting everyone's voice, where all are encouraged to express their ideas. For example, diversity. There's a great diversity in the animal kingdom. Common sense.
Yeah.
Equity. It is only equitable. It's only equitable that Dr. Smith be elected chief of staff, as he performed outstandingly and has shown good leadership skills. And inclusion. Joe should be included on the all-star team, as he has the best batting average, the most home runs, and is a superb fielder. There are a few examples of what I believe to be the definition and samples of DEI, which encompasses the symbiotic relationship, philosophy, and culture of acknowledging, embracing, supporting, and accepting those of all racial, sexual, gender, socioeconomic backgrounds. Jennifer, do you agree?
Yes, I do agree. I do agree. And I would also add another term to that also is justice. And so justice is really looking at, I think, the history of where we are right now, and looking at exactly eradicating certain things in order to be able, so that those in who are less fortunate and those who are not on the or on the bottom end of justice do receive justice. And so that is also a part of the DE&I framework. And that's what the Urban League believes. And so, we are nationally an organization over 100 years old. And we started off as a social service organization. And in the 1960s, Whitney M. Young, our national president, who was very good friends with Dr. King and Coretta King, and they urged Whitney Young, they said, listen, the Urban League cannot just be an organization of social services. It's great that those who are suffering receive health care and receive education benefits and receive services around workforce and housing. But you also have to be on this other side, too, which is talking about, again, that justice part, right? Mm-hmm. Because we can give all the resources out, but how do we prevent this from happening in the first place? And so I always talk about my team when, we do rental assistance as one of our programs at the Urban League. And I said the average person coming in for rental assistance who's looking for month to month to make sure that, hey, we can make ends meet, is not the person who's worried about SB 101, right? But as a civil rights organization, it is incumbent upon us to deliver the service of rental assistance, but to also be that voice down in Dover to ensure that renter is actually covered and has rights, so that this won't continue to happen. So that's what I would add to that, justice.
That's justice. Okay,
yeah.
Very good. Okay, in your mind, how does this concept differ from affirmative action, which was in September of 2023 struck down by the Supreme Court in a case of Students for Fair Admission, Inc. versus President and Fellows of Harvard College and versus the University of North Carolina, which noted that admission criteria to higher education institutions should eliminate racial discrimination. This was presented by the Chinese American Citizens Alliance of Greater New York, who felt that they were unfairly treated in the admission process. Can you comment on how this differs from affirmative action?
Yeah, so, again, this is another history point. Affirmative action was one of the first reiterations or iterations of what we see as DE&I. And so affirmative action, let's think about the way in which it came about and also who it benefited, right? Mm-hmm. Affirmative action, when it was originally conceived, benefited mostly white women in the workplace, right? We're looking at a lot of our corporate communities, and that's really where affirmative action went to. But when we think of DE&I, right, it's really it's a beautiful and new term, which is a great term, but it really was a term that was created by our corporate communities to say that these are efforts in which we're going to make to ensure that we're committed to diverse workplaces, right? And let's just also think about this too, and where it came from. DE&I is also very much an economic term as well, and so it is very much found by many economists that when you have diverse voices at the table, you make more money, and so it's incumbent upon certainly our corporate community to be diverse and to be equitable and to be inclusive, and so I wouldn't necessarily say that DE&I is different than affirmative action. It is almost like the grandson of affirmative action, if you would say, so to speak, and then I would argue that affirmative action is probably the grandchild of the civil rights movement, right? Mm-hmm. And then we can keep on going back into, but where the overall goal is again what we're moving towards. These are different reiterations of making sure that justice is served. And I have this great quote, Coretta King, and I was talking a little bit about certainly before we started recording about certainly my research on Coretta King, who was a great freedom fighter in her own right. But she has this great quote where she says, "Freedom is never really won in each generation, right? It has to be re-won in every generation, right? And so it's never really won." And so when I think about the civil rights movement from the 1940s all the way to 1970, when I think about affirmative action, which really came to be around in the 1980s, and now DE&I, which is now in our times, and unfortunately, if indeed our country goes in a certain direction. I'm not exactly sure whether we'll be talking about DE&I. It'll be something else, because there are concerted efforts to make sure that those DE&I practices are not carried out. And so, that's where we are right now. So I wouldn't say, again, that it is different, but it certainly is a reiteration of affirmative action.
I like the way you brought that, grandchild, child.
Yeah.
That's pretty good. A little plug for you. I understand you're going to be writing a book on Coretta.
Yes, I am. I'm in the midst of doing this. I don't even know if Dr. Teal knows that yet. Yeah. But so when I was in graduate school at Harvard University, I started my research there, and I was fortunate enough to come along some primary source documents, which really just lit a fire in me. And I think it's also I truly believe in zeitgeist, and so right timing, that German term for right timing, and understanding where we are now in our nation. Many voices of those of the past who really the same themes were happening, right? But we have a fresh perspective on them. And it's the same thing even with a lot of what we're doing with the Urban League and also in other DE&I areas, right? In that these kind of themes have been around for a long time, but our perspective is different, especially given, again, and I'll just mention in our political climate right now, is really giving a different perspective on a lot of these things. And so I believe it's right timing. It's right timing for this podcast.
Zeitgeist.
Yeah, zeitgeist. Yep. And so I studied German for about...
Too.
You did?
4
Okay.
years college.
4 years. Okay. I was about 12 years. Asked me to speak something other than zeitgeist. I
You don't use it, you lose it. Believe me.
And that's exactly right.
I could at one time speak it, write it, and read it.
There you go.
And we didn't speak anything in the class but German.
It's very close to
5 years
English.
out, I can go, Ach, der Lieben.
Yeah. Tschüss. There you go. That's me. Tschüss. Yeah.
Okay. Very good. Very good. Okay. Now, an important question.
Sure.
How does DEI play into meritocracy? Where does the meritocracy concept play into DEI, if you want me to put it that way? Does merit win over selection or inclusion of a candidate due to lack of racial, gender, sexual, or socioeconomic standards? How does meritocracy play?
So I'm going to say it. So a couple of things, but I'll start off with this. And this is a quote by Dr. King, actually. It says, how do you expect the Negro to get ahead when they're 300 years behind? So again, this is speaking of, it's very hard to judge a race. What I mean by a race, meaning like if we were actually running track, it's very hard to judge a race if we all don't start off on the same foot, right? And so that is at the problem and also what we're trying to fight as far as justice, right? And so, I'll hear many a times, even in the work that we do with the Urban League, oh, why does this population receive, right, these type of services? Oh, why do these students, right, receive services from the Urban League, but yet you won't go to, say, a privileged school, right, and do the same thing? Well, you think about the resources, right? They're not the same. And when you're talking about those who have limited resources, you have to put more resources in order for them to catch up, right? And so that's just it. Where we see this thing of meritocracy, this is very interesting because when I think I am a Harvard graduate,
yes,
right? And so my degree says that I graduated magna cum laude, right? Thank you. And when I went into a Harvard classroom, maybe some of my classmates might have thought, I don't know, no one ever was gutsy enough to tell me, but might have thought I was there because of affirmative action,
or
right?
Tokenism.
Or tokenism,
right.
Very much so. But when I sat in that seat and I was able to, I was just as intelligent as anyone in the room, right? But had it not been for certain programs, certain accesses that I had to different programs, different resources, I might have not have been sitting in that seat. Not because I wasn't smart enough, right? But because of access. And so when we really talk about affirmative action, DE&I, it's really about access, right? Do I have a seat at the table? Am I invited into the room? Let's just be clear. Am I invited at the room? Then are you going to give me a seat? So that's the second part. And then last but not least, are you going to let me speak?
But you got into Harvard due to merit.
I did get into Harvard due to merit, but I will say there were probably 50 other applicants who were just as brilliant as I was.
So
right?
why did they pick you?
I don't know. It's because of, I'm not exactly sure why they picked me, but I will say I did earn every piece of me being there at the table. But what I believe is that, I went to Ursinus College, a very high-end liberal arts school, cost about $70,000 a year, right? Had I not received a full scholarship there, I might have not even had access to a Harvard University, in which I did receive a full scholarship there as well, right? But I could tell you that there are probably, for one Jennifer, there are probably 10 others, right, who are just as brilliant, just as smart, but do not have the access. And so where we look at DE&I, I'm always get it tongue-tied, but DE&I.
I just said DEA before.
DE&I. When you say it fast, right? What it is to hopefully to lessen the gap that exists, right? And to get more diverse groups around the table. And so again, because this is the table should look and be reflective of the world in which we live in, right? If the table does not look like the reflective of the world that we live in, how do we actually expect to get to a place where we do have a more equitable world?
Gotcha. You worked hard, though, you studied hard.
Absolutely, but I believe all my other classmates did as well.
Really?
Yeah, all of us. Oh, yeah. Now, Harvard's not a kind of place you can skate by.
I understand, but to get there, you worked hard.
Oh, absolutely.
Through high school, college, etc., right?
Absolutely. But I will tell you this: my grandmother, who didn't have access but to a 10th grade education, and she picked cotton. She worked hard too, but didn't have access to Harvard.
Understand.
Right? And so that's what we're talking about, that starting place. It's very, very different. I would sit with my Harvard classmates, and it was fascinating because, we also talk about this idea of being in the room and also owning information, right? Okay. And so I think about the young people who we do programs with on the east side of Wilmington, and the way in which, they're very prideful. And they're absolutely brilliant, right? They're absolutely brilliant. But I see the difference between the way in which they own information and if I was to take the same students or the same kinds of students, right? And it was at an academy, right? And the way in which they own information. And so you see that difference. And when we talk about education, we see that difference in the way in which our young people are taught. And if they're not given the access, that's the difference.
Is
right?
that owning the information?
Yeah, that's huge. Bell Hooks talks about how she used to teach at Princeton. The novelist, the writer Bell Hooks, she taught at Princeton, but then she also taught at SUNY New York, which is a state college. Mm-hmm. And she said, my students at SUNY New York, right, are just as brilliant as those students at Princeton. The difference was the ownership of information, right? And so, and she gives this example, and I noticed it even in the Harvard classrooms. A lot of my more privileged classmates, who happen to be white, right? They literally would talk about, we were reading, I believe, something about Martin Luther and the 95 Thesis, right? The way in which they taught, if I closed my eyes, I would thought that they were there with Martin Luther as he literally pinned the 95th Thesis onto the church in Wittenberg, right? Mm-hmm. But it's just this kind of ownership of information that's a little bit different. And so where I say, okay, what's the difference? Because I'm just as smart as these guys who are here. What's the difference? A lot of times it's about access.
Okay.
Yeah.
Very good. All right. Does DEI encompass or favor wokeism? Now I'm going to define that out of Wikipedia. The promotion of a liberal progressive ideology and policy as an expression of sensitivity to systemic injustice and prejudice. How does wokeism, or does it play into DE&I?
You're talking about being woke?
Being woke?
Listen, as we talk about being woke.
I should have called you she, he, or she, her.
What do you mean? About pronouns. Okay. Yeah.
It's very confusing to be quite honest. But tell me about it. What do you think in this?
So, I mean, certainly being woke, right, is just simply being aware of the world in which you exist in, mm-hmm. right, and acknowledging that world. And so oftentimes I think, what wokeism is calling out is really this idea of American idealism, or not even idealism, this American dream or narrative, right, in which we live in a bubble, and we just simply don't. Now, some folks are privileged enough that they can do that, right? And so I know, I was at Harvard with folks who've never even been in a classroom of Black folk, and it's just like, what? How can you live in a world like that where there's a lot of, but when you have privilege, that kind of affords you that there is a possibility, right, of that. And so, being woke, again, is just acknowledging and understanding the world in which you live in. And that's simply what it is. And so when we talk about, does wokeism show up in DE&I, it just ought to, because in order for you to understand that there should be diverse people around the table, and that not only for them to be around the table, but it literally is essential, right, for any organization, for any school, for any think tank, anything, right, to be functional, to have diversity. And diversity is just not about race. Diversity is just not about race, right? Diversity is about socioeconomic status, diversity, sexuality, gender, all of that, right? And so, we may see institutions that may be all one, racialized, maybe one race or majority one race, but that does not mean that they're not diverse, right? We look at a lot of our historically Black colleges and universities, and I wasn't privileged enough to go to one, but my father did. And so my father, he glowingly talks about Virginia State University and how he was part of the crew that, he wasn't into sports, he wasn't into the fraternities, he wasn't into that, but he was kind of the guy who was from Philadelphia, who was more so into, he, during college, he really explored a lot of justice when it came around food, oddly. And so it was this huge movement around not eating pork. And so for those, it had nothing to do with religious connections, but it really had to do with, a group of folks on campus, Black males, who really started to understand the connection between justice and food, right? And what are we putting in our bodies? And so he was very much a part of that social justice group, and he didn't deal with the fraternities. He didn't, he wasn't from, say, a town in Virginia or any of that. And so, he talks about all these kind of folks that were on his campus as an HBCU student, right? And so I think it's very important to acknowledge that diversity does, show up in different ways. But again, being woke and understanding, right, diversity and understanding inclusion and understanding equity and understanding the world that exists around us is absolutely key to really grasp and to really work in this DE&I space.
I'll take it a step further. I also think that it also, wokeism is a term that is meant to be, I think, derogatory in nature. But if we spin that around, it should be tolerance and acceptance. We recognize and acknowledge that we are all different people. We all have different backgrounds. We come from different fabrics, and
but equal in the eyes of God and in the eyes of God.
But we're not equal in the eyes of each other. Right? And so the idea is to learn acceptance as well as tolerance. And just one thing that's really important to point out here, when it comes to equity and equality, we may be equal in the sense that we're all human beings, right? We may all have bicycles, but equity is that you have a bike that fits your height. Right, and your size, and you have a bike that fits your size, and you have a bike that fits your size, and I have a bike that fits my size. But equality is that you all have a bike. What are you complaining about? And that's the issue.
Good point. I see your point.
That's the issue.
Very good. Thank you. This is a good time, I think, we take a short break and come back to our guest, Dr. Cydney Teal and Jennifer Thompkins. We'll be back shortly.
Information about the Medical Society of Delaware can be found on our website, medicalsocietyofdelaware.org. Questions about our podcast can be emailed to healthcare.reality@medsocdel.org. That's medsocdel.org. Once again, here's Dr. Nick Biasotto.
Hi, this is Dr. Nick Biasotto, back from our break with our guests, Dr. Cydney Teal and Jennifer Thompkins. Okay, next question. In my research on this subject, I came across an article penned by Jessica Guyn, I think that's how you pronounce her name, Guynn, that said that the backlash against DEI has not been as successful as it seems. The article appeared in the Wilmington News Journal in July of 2024. It seems that the majority of corporations, 83%, have stayed committed to the DEI concept or increased the commitment by 13%. The article also stated that the political environment has not weakened in support of DEI. However, some Fortune 500 companies such as John Deere and recently Tennessee Fortune 500 company that sells farm supplies, animal feed, and tools have slashed their DEI and climate goals after public pressure campaign. Recently, I've read that Harley Davidson is also in that category, and I think Toyota has taken that move also. What are your thoughts on this? And is this all due to a pressure campaign? Where's the pressure coming from? And is it just?
Well, so thank you so much for a little bit of that research as well. And so I knew a lot about those companies. I didn't realize and recognize that Toyota was near behind them. And so what you do have is a simple case of, and let's take it back to the playground, of bullying. And so, you have certain organizations or corporations who do not want to stand up to the bully. And so they drop these, right? And then you have, certain investors in these corporations that are literally bullying, right? And so the danger of this is that you have one or two big companies that start to do it, others start to fall in suit, right? And we see this, and this is, when we see these occurrences, this happens throughout history, right? You see one community that starts to, buckle at this, and then, it's not longer, it's not too far down to say that, okay, this will continue to happen. And I believe as a world community, we have to call it out and say that, the corporations who are abandoning their DEI practices, they need to be called out. And I will say in the Urban League movement nationally, our national leader, Mark Moriel, has done that. And certainly we are ready, even on a local level, to call those things out, because essentially you cannot say that you are for justice, right? With something as simple as DE&I and having DE&I practices within your corporation aren't just, right? And so that's where we are. But again, the danger is, these type of things are almost like an infection, right? And so if it could start off as a small paper cut, but then it can go into a large wound if we're not careful. And so that's why we have to stay woke.
Gotcha.
Yeah.
You talked about the bully in the schoolyard. Well, the worst thing you could take is a rap in the nose from the bully. But these companies have seen their profits go down because of the individuals that were opposed to it. Look at what happened to Bud Light when they had a transsexual on as an advertising agent. And boom. I don't think Budweiser itself has recovered from it yet. So it's an uphill battle, I think. Will it be won by either side? I do not know the answer to that. I hope justice prevails, but we'll see. It seems that the right and left in our political system are also at odds over this, with the over DEI mandates, for example, with the right introducing bills to restrict DEI in education, state government, contracting, and pension investments. And the left is going all out to incorporate the concept of DEI into everyone's daily life. How do you feel about this disunity in our nation? And is it able to be resolved? Is there a middle ground?
Yeah. Well, again, I'm just full of Dr. King quotes, but maybe it's because of the discussion of
DEI. He's a good man.
Yeah. And so, to quote Dr. King, the arc of the moral universe is long, but it always bends towards justice. And so in these situations, we have to believe that justice will prevail. But what do I say to those corporations who are constantly losing money? I will say that they're going to, there is a danger with not having diverse folks at the table, right? And so I think it has also been proven that when companies have embraced fully diversity, equity, and inclusion, and having diverse folks around the table, that their profits have actually grown. And so this is where we really have to take those stances to lean more so into the DE&I space, and then to also really look at diverse ways of also making business, right, and doing business. And so I can name a few organizations. I mean, Starbucks was one that has really astronomically has grown over with doing DE&I practices, and actually they're a partner of the National Urban League. Target is another one that has exponentially grown as well with their embracing of DE&I. And so if you go into Target stores now, they're incorporating small Black businesses into their model, right? Which has broadened in their scope as far as getting those from diverse backgrounds to purchase more clothing from them, right? And so it's a model that works. And so what I would say and what I would encourage is certainly that these organizations and these corporations really look at diversity and inclusion with a more intentional look in order to incorporate and to be able to continue to raise their profits in the business space. So I believe, Dr. B, that's all I can offer to that one. Because you got to have some guts to stand up to the bully. That's just what it is.
That's a good way to put it. But my point is that how does the companies such as Target or Starbucks tell Toyota and other companies that have saw their profits go down, because how can they encourage those profits to increase by going back to DEI? What worked for Target and what worked? Why didn't it work for other companies that said no problem, I'm not doing it anymore?
Yeah, I mean, so let's just use an example of John Deere. Am I saying that the right? Okay, right. And I wasn't sure whether it was John Deere or another, but John Deere. There is a whole diversity and equity issue when we're talking about Black farmers, right? Which has not been elevated by a corporation like a John Deere, which I believe is a huge demographic of farmers across the U.S., right? So if you refuse to bring them to the table, well, hello, right? I mean, this is, right. So, and that has been kind of a refusal that has gone on. And so, again, from a national level, from the National Urban League's perspective, we're calling that out, right? And saying that there is ways to do business with incorporating DE&I, but you got to want to. That's the other part of it, too, right? There has to be a want in that.
But it has to work for that company.
Yeah.
Is there a company it won't work for? Mm-hmm. Such as, John Deere, Harley Davidson, things like that.
Yeah, I mean, I will say these are historically companies, right, and corporations that have, I believe, have catered to a certain demographic, but I think it's time in the world that we're living in that we do, you start to expand those efforts, right? Those DE&I efforts, and just to quote, right? Companies in top quartile for both gender and ethnic diversity and executive teams are on average 9% more likely to outperform their peers, right? So when you have people, just not DE&I on you say your mid-level positions, right? But those executive teams, that's where you really start to see DE&I. That's where you start to see profits go up.
Very good.
Okay. The other piece is this, and we need to just think back just a couple of years. And what we learned in our nation during the pandemic is that we were outsourcing way too many of our goods, right, and our services. So everything was overseas. And I think that this is sort of the pendulum coming back home, and there's a reflection in the industry in terms of, in a recognition that we in the United States have got to turn that practice around. We have got to have a greater investment in our goods and services.
I agree.
To the point that Jennifer just made, if we have a preponderance of DE&I farmers out there who have crops and have produce and have services and goods that are necessary for us to be sustainable, especially as our climate is changing, would any company actually go overseas rather than just get it from home? I mean, how long do you think that they'll stay in business? How long will John Deere, if they can get their parts here in the United States but choose to go to China to get their parts, how long do you think they'll stay in business?
Not very long.
That's exactly right.
Well,
so
hopefully
that's
in the future
the other
we
piece.
see that turn around.
Yeah, that's the piece that we have to think about.
Yeah,
okay.
And then I will just say, from a civil rights perspective, right, this is where us as a civil rights organization like the Urban League and others, right, we go back to some of our kind of day one practices of boycotting, right? And so, when we think about the Montgomery bus boycott in 1955 and 1956, the Montgomery Bus Company, I mean, it was an economic decision. They didn't all of a sudden, just feel in their hearts that folks were equal, right? It's an economic decision. They would have bankrupt. I mean, a day later, they said they would have bankrupt, right? If they hadn't interrupted and said, listen, everyone, it's going to be equal. We're good, right? The boycott is off, that, all the whites only signs will come off on the bus. If they might have waited 2 more days to do that, they would have completely bankrupt, right? And so I think this is also incumbent upon us, even from civil rights organizations. We have to speak out against this, right? And we have to, and sometimes the voice and the power comes from the people. And so when we start boycotting these places, that's really where folks wake up. And sometimes the people can be larger bullies than the opposition.
Well, Budweiser was boycotted.
Yeah,
and that took them down. So, Daniel Opong, a founder of Courage Collective and a consultant advisor on DEI, said DEI was created because marginalized communities have not always had equal opportunities for jobs, or they felt no sense of belonging in certain settings, i.e. create a workforce where all people could thrive. True or false? Do you agree? I guess that's a no-brainer, right?
Yeah, absolutely, 100% agree. And I think it goes back to, again, the quote in which I, said earlier that how do you expect folks to catch up when they're 300 years behind, right? And so we are just and I can go back through the history, right? We are just now getting to a point, and we're just now truly addressing a lot of these inequities that have happened in our history, and trying to, again, lessen that gap. And so
hasn't it lessened though?
It's as
it's
a
not
whole
300-year gap at this point.
It is when we look at home ownership rates in which we obtain wealth, right? I mean, it's starkly, and I will say this quote: home ownership within the Black community is actually less than it was in 1963.
Really?
Yeah. When we look at the state of Delaware, right, it's far less than it was in 1963, right? And so you do have some of these gaps which are widening, right? And when we think about, let's just take the home ownership thing, right? And I'm going to put this back in perspective. If we take home ownership, the likelihood of me owning a home if I don't have so let's just start there. If I don't receive a good education, right? Boom. Then if I don't receive a good education, what job am I working, right? Whether I go to college or trade school or whatever, right? What job am I working? Because what access do I have, right? And then do I now, you have unfair banking practices, right? So what mortgage am I being approved for? And depending on the mortgage that I'm being approved for, depends on what neighborhood I live in, whether I rent or own, right? And then that begins the cycle again for my children, right? Now, where you're fortunate enough for like a Dr. Teal and I, right? Dr. Teal is a physician, and I'm I'm just trying to lead a nonprofit organization, but again, well educated, right? Our trajectories look a lot different, right, for what we will have for our next generation versus someone who doesn't have that access and opportunity, right? And so that's where we're seeing these large gaps, and we're seeing them. I mean, some of them, yes, we're closing in on certain things, but things where it really matters, I will tell you, education. Delaware, we are faring very low in education. We got to understand it's only 50 states, and I think we're 47. And remember, Mississippi in there, Louisiana's in there, Alabama's in there, right? Listen, and I love those states, right? I love them, but they're horrible in education, right? And so, and we're in that talk right now to be such a small state that really is abysmal. When we think about our housing crisis, the supply does not meet the demand, right? And so the amount of homelessness we have is extremely high. But then also, again, like I said, the lack of home ownership because of housing prices is extremely high. And so that's where we're, this is the world in which we're living in, right? And so if we do not talk about DE&I, if we do not talk about giving access to those who don't traditionally have access, then we really are talking about an injustice, right? And that's what we need to be able to call it. And so, DE&I is it's a nice term, and it's a term that's used within corporations, and I love to use the term as well. But then we take that a step further to say it is when we say that these practices aren't going to take place and that folks aren't going to make sure that DE&I practices are taking place within that workplace or within the corporations or within the educational institution, we are really saying that we are standing up for injustice, and that's the problem.
Well, let's take a good DEI state like California. I couldn't buy a house in California.
No, you got that right.
A little one, maybe. Yeah. All right, let me get to the next one.
Well, the wages will match.
It's crazy out there. My daughter lives out there. I say, how do you still live out there with your husband and my 2 grandkids? Okay.
Yeah.
All right. Now, on the other hand,
yes,
an opponent of DEI, Heather McDonald, said diversity is a word for anti-meritocracy. Okay. I know we discussed the meritocracy earlier, but do you agree or disagree with the statements that she said? She also said that the problem with inequity arises from the breakdown of the family unit, i.e., a mother or father who better their children's lives with good upbringing in hopes that their children would do better than they did. Do you agree with her statement and rationale, and how do we solve the breakdown in the community of the family unit, which I feel is most important for the development of healthy and wise children? I really do. We need the family unit back. But go ahead, take it.
So I'll answer it this way. No, I do not agree with her statements. However, I do think that there's something to be said about family, right? And so, but I also think that the breakdown in certain communities, particularly those who are impoverished or disadvantaged communities in the family, there's a connection there, right? And a connection that is a systematic connection and not necessarily an individual connection. And so when we think of practices, right, that were done in the 50s and the 60s and the 70s with males not being in the home or could not be in the home, right, because of assistance, that's where we start to break a lot of that down over generation.
They couldn't be in the home because of what?
So assistance. So if indeed you were on federal assistance, right, there was a mandate that men cannot be in the home, right?
Oh, really?
So, and so you break down, and you had social workers come to the house, and if there was a remnant of a man, you would no longer get assistance, right? And so when you have those type of practices and those things that are in place, yes, it breaks down a family. And so imagine a child who only sees her mother who's raising her whole life, right? And so you're right, there comes along this generation of possibly not looking at the family unit, right? But I would also say this too. I think a lot of that narrative has been highlighted, but the other narrative has not, right? I will say in most lower income communities, the family units are actually stronger, but they look different. And so let's just be very clear, right?
Describe the difference.
So meaning that a family unit doesn't necessarily have to be a mother and a father, right? A family unit can be a mother and a grandmother and a great-grandmother, right? Or a grandfather and a great-grandfather. It can look very, very different. And I would say in communities, particularly those that are, underprivileged or underserved, you do have, out of necessity, right, multi-generational living, which is, indeed a strong family living environment. And then you also have, you have familial support, right? And so I'll give an example of my great-grandmother. She grew up in Plum Branch, South Carolina. If you've ever been there, there's one stoplight, and that's it. There's one blinking stoplight in the entire town. She packed her bags in a Great Migration, right? And she came up to Philadelphia. She was the oldest out of 10 of her siblings. And so it was, she got here. She actually worked with the Urban League. The Urban League got her a job. And she was one of the first homeowners in a majority Jewish neighborhood in North Philadelphia. And this is in the 1950s, right? And so it was because of her having that home that she brought up all her other siblings. And each of them, they came through her house, right? They lived there for a period of time, and then they got their own homes, right? Now, at the time, my grandfather did not live in that home with my grandmother, right?
Because of that ruling?
Not necessarily because of the ruling. There were some other things in there, around.
No.
no. And it was, obviously you're talking about racial terror in the South, right? Mm-hmm. And so my grandfather, before my grandmother came up here, my great-grandfather, he came up to Philadelphia ahead of her, right? And started a new life because she was not ready to come yet, right? Mm-hmm. But again, he was forced out of Plum Branch, South Carolina because of racial terror. Mm-hmm. He couldn't come back to the town, right? Mm-hmm. And so you have these practices, these stories over and over and over again. And when you're talking about this breakdown because of systematic forces and also because of racial terror, that's what has led us to where we are right now. And again, we have to acknowledge that part. I'm not saying, right, that any community is perfect. But what I am saying is that America as a whole, has to be very honest, right, in the way in which they did not do DE&I, right? The ways in which you're talking about coming into a country with Native Americans and wiping out, right, Native Americans. The fact that coming in and bringing slaves over, right, there was never a formal apology of that, and how that has led to generational things, right, that we are still even seeing in the Black community and also other communities as well. We're thinking about the civil rights movement, lynchings, and all of that. There has to be an acknowledgement of that history before making blanket statements like that, right?
I think it's out there and acknowledged. I'll acknowledge that it happened.
I don't think it's acknowledged by that sister who said that quote, that's I'm just referring back to the quote. Gotcha. And so when we don't acknowledge that history, it does lead to blanket quotes like that, and it's just simply not true.
Okay.
Yeah.
Well, we've talked about large companies, DEI, either they accept it or they don't accept it. Now, how does DEI play into those mom and pop places or small businesses that are being run? And DEI, are they more accepting of the process, or are they not receptive?
Yeah, so, one, let me just start off. The majority of small businesses actually don't have employees, are usually, no. I will tell you that it's an overwhelmingly amount of small businesses, and I think, we kind of see those that are pictured maybe on the CBS Morning that have, multiple employees and things like that, but the majority of small businesses do not have a ton of employees, right? So as far as hiring practices, right, there hasn't been, I will tell you, a ton of research done on that. Now, where small businesses come in a DEI space is really their access to capital. Right. And so where you, and this is where the larger banks and all do have to acknowledge, right, diverse businesses in this. Right. It also comes along with contracts. Right. There are, cities and states who do have, clauses within city contracts. Right. That you must hire a minority owned business or a woman owned business. Right. So that's where it comes in. This first started with Atlanta with Mayor Maynard Jackson, who really, through that airport project, right, that they have, which is the largest airport in the world, the busiest airport, in the world, he made sure that D&I practices were even practiced, and that was in the 1970s that came about, right? And so other cities have followed suit. I know Philadelphia is huge. I know Delaware, we are in the talks of this, because again, when we want diverse folks at the table, how do you do that? Well, making sure when a construction contract goes out, there has to be 10% of that needs to go to a diverse-owned business, right, or woman-owned business. So that's where you really see diversity and inclusion show up, right?
More accepted.
Yeah,
okay.
yeah. And so, but again, the majority of small businesses, if they don't have the access to capital, they're not surviving, right? And so and then again, going back to larger companies, they're starting to invest in more diverse small businesses as a DE&I practice. So just not internally, but thinking about how can we invest externally in this. And I use the example of Target, right? Mm-hmm. And so Target is really investing in small Black-owned businesses or minority-owned businesses. You'll see different products, right, from minority-owned businesses through there. And so again, that's part of their DE&I strategic plan or impact that they have as well. So that's what I would say to that.
Good.
Yeah.
Well, to wrap this up, I'd like to ask Dr. Teal a question. Cydney, we have in this state and in the country a shortage of primary care physicians. Mm-hmm. We are trying to substitute with nurse practitioners and other arms in medicine to help deal with our patients or deal with patients that are lacking good care. it seems like DEI may be able to help in this realm because it would help get more individuals involved with patient care. What's your feel on this?
Yeah, it's a great question, and I'm glad you brought it up because I think it's really important to recognize that DE&I is pervasive throughout every industry. Mm-hmm. And in healthcare, and Jennifer spoke about this before, when we think about why we go back to affirmative action, civil rights, affirmative action, and DE&I, the underlying theme, in addition to justice, is access. Mm-hmm. And so what we are afforded now is that we have to solve a problem as a nation, as a state. That problem is we have a shortage of physicians. We have a shortage in the healthcare workforce. So how are we going to do that? We have to come together as a state, as a nation, as a community to say we need to be able to find people who are interested in getting into this work, who have a passion for it, who have a desire for it. What has happened, unfortunately, historically, is that we have looked upon specific gender and a specific homogeneity of people to provide healthcare services historically. And now we're recognizing that our world has changed. The needs of our communities are very different. And in order for us to meet the needs of our community, again, we're talking about equity, not equality, right? Equality is that everyone has access to health care. Equity is that you have access to health care the way that you want to be treated, by whom you want to be treated. And so really what our charge is in the DEI subcommittee, what our charge is, I think, from a healthcare standpoint, is to identify young people especially who have an interest, regardless of what they look like. I'm just going to be really blunt. What they look like, if they have a desire and an interest to go into healthcare, that we give them every tool in the toolbox to make sure that they are set up for success.
Good point.
I grew up right outside of the Washington metropolitan area. Both my parents were engineers. I was afforded the opportunity to go into pre-medical, pre-health programs that launched me into medicine early when I was in high school. I look here in the state of Delaware. There are very, very, very few programs that are available for young people in general. Good. And so really that's what we're going to do. You got it. So we recognize that there are many, many young people who have an interest and a desire, but they don't have someone there to say, I'm going to help you get through this. And so that is what we're here to do. That's what we're here to do as our organization, Delaware Health Equity Coalition. That is what Metropolitan Wilmington Urban League. There are so many community-based organizations, and that's truly what we're trying to do with the Medical Society in the DE&I subcommittee.
Very good.
Yeah.
I would like to thank our guests today, Dr. Cydney Teal and Ms. Jennifer Thompkins, for all the information they brought to the table and answered all the questions appropriately and educated myself, and I'm sure anyone else that would care to listen will get a bit of education on this subject. This is our 12th podcast. I do believe that we have many more lined up, so stay tuned and hope you enjoy. So this is Dr. Nick Biasotto signing off from Delaware Healthcare Reality Podcast, sponsored by the Medical Society of Delaware.
This has been Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. Delaware Healthcare Reality is produced by Tom Mitten. I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the host or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.